Today we will be looking at public radiation dose limits and how it relates to public health. We're going to take a look at linear no-threshold model and also hormesis. For a brief overview, we will first go over an introduction to radiation. We'll take a look at various sources of radiation. We'll take a look at the public health policy and the public dose limit. We'll look at what that's based on, which is the linear no-threshold model. We'll take a look at background radiation and its different sources. We'll look at the hormesis model. And finally, we will look at ways to modernize the public dose limit. Ionizing radiation is composed of subatomic particles and waves that can ionize atoms or molecules. What this means is that the particle or wave has enough energy to break an electron off of an atom. It's composed of alpha particles, beta particles, neutrons, and gamma rays, and at high doses can cause radiation sickness and death. At lower doses, it can cause cancer, tumors, and genetic defects. Sources of radiation are broken into man-made and natural. Man-made is composed of medical X-ray and CT scans, as well as devices such as linear accelerators, which can be used for cancer treatment. Nuclear medicine also uses various radioisotopes. Combustible fuels, such as coal, can be burned and release radioactive material into the air. Nuclear power is another source of man-made radioactivity. Natural sources are mainly composed of radon gas, which is a decay product of uranium. The gas slowly seeps into the basements of buildings and accumulates over time. Cosmic and solar radiation are other natural sources. The public health policy that we'll be looking at today is Title 10 of the Code of Federal Regulations, Part 20, Subpart D. It states that the total effective dose equivalent to individual members of the public from a licensed operation does not exceed 0.1 rem, or 1 millisievert, in a year, exclusive of the dose contributions from background radiation, from any administration the individual has received, from exposure to individual administered radioactive material. This is the same recommendation that the International Commission on Radiation Protection gives. As stated on the previous slide, the public dose limit is exclusive to any radiation dose received from natural background or from medical procedure. We can take a look at the wide range of background radiation doses per year according to geography here. If you can take a look at the high, which is in a beach in Brazil, it's 790 millisieverts per year. Now this is a beach with black therapeutic sands that are a result of erosion from the surrounding mountains. This dose is almost 800 times more than the current public dose limit in the United States. And on the low end, we can see that in San Francisco it's 0.8 millisieverts. The high in the United States is in the U.S. Rocky Mountains, between 6 and 12 millisieverts per year. We can compare this to an evacuated area near the Chernobyl site, the area of a nuclear disaster, which only has a background of 6 millisieverts per year. As you can see, there's extreme variation depending on geographic location due to natural background radiation, which almost makes a public dose limit of 1 millisievert per year irrelevant depending on where you're located. The current recommendation from the ICRP is based on the linear no-threshold model. Now this model assumes that damage is caused by radiation and increases linearly with dose with no threshold. What this means is that it doesn't matter how small the dose of radiation is, that there is always an increased risk in cancer. Above the threshold line is the known dose response that's been determined from studying the survivors of the Hiroshima and Nagasaki atomic bomb. What they have done is taken the higher dose known values and extended it linearly into the lower dose ranges, which are not as well known. This line can then be used to estimate the potential cancer risks in the lower dose range. The idea of hormesis has been around for a long time. It says that a low dose of radiation can trigger an increase in damage control system activity. Now, this can help to deal with trivial radiation damage as well as larger endogenous cell damage, which could eventually cause less cancer overall. The idea of hormesis has been long debated. Over the years, it has gained more and more support as research on the effects of low dose rates becomes available. I believe that the public dose limit should be modernized, acknowledging the validity of the hormetic model. I would recommend a tenfold increase in the public dose limit up to 10 millisieverts per year. This is comparable to one whole-body CT scan. This would help to improve public perception of radiation as only bad by acknowledging the hormetic model and the positive effects of low-dose radiation. This would also help to decrease the costs associated with excess radiation protection. Areas such as X-ray and CT facilities, as well as linear accelerator vaults, are required to have shielding that will limit the dose in adjacent rooms and outside areas. This is an example of a linear accelerator vault, and as you can see, requires large amounts of shielding. The walls seen here are 4 feet of concrete. This single room costs $1.4 million to construct in order to meet current public dose limits. A change in public dose limit would allow for slightly thinner walls and help save on construction costs while not increasing health risk. The benefits of a relaxed public dose limit would be improved public perception, as stated earlier, and lower construction costs for radiation therapy facilities. These lower costs would then be passed on to the patient. This would allow for an increased availability for treatment to the public and help to lower the overall healthcare costs, which would help to decrease ever-rising insurance costs. This policy is an example of several of the 10 essential services to public health. Essential service number 3 informs, educates, and empowers people about health issues. Educating the public about radiation will help to improve public perception. Essential service number 7 links people to needed personal health services and assures the provisions of health care. This change in policy would increase the availability of the treatment and help those who would otherwise not be able to afford it. The use of new research in developing this policy is a perfect example of essential service number 10, which uses research to create innovative solutions to today's health problems. Today we have looked at the public radiation dose limit and the possible benefits of increasing the limit from 1 millisievert to 10 millisieverts. This change in policy would begin a movement of using scientific advances in research to modernize old policies. This would have vast economic benefits resulting in lower costs and increased treatment availability, having an overall positive effect on public health.